Hi, welcome to the Spine MDT. I'm Anthony Ghosh, a consultant neurosurgeon and founder of the Spine MDT. And this video is about driving after spine surgery. I'm specifically going to show you what the evidence suggests. Video on recovery after spine surgery, what to expect, where I brush over it. But this video specifically talks about driving, as it's a common question I get asked. In a few of the British Association of Spine Surgeon booklets on the different types of operation on the spine, they usually advise a period of 2 to 4 weeks, at which point you should feel safe to do an emergency stop, and that's pretty much what most people advise. Another factor to consider is your sitting tolerance, how long you can sit for and not be too uncomfortable or in too much pain. So we usually advise about journeys of no more than 20 minutes to begin with, and then gradually increase it. But let's have a look at what the literature actually says about all of this stuff. The advice given is anecdotal, and it does vary a bit between surgeons, but also depends on the type of operation you've had. However, this is quite an important study carried out, published quite a while ago in the Global Spine Journal by colleagues in the United States, mostly in California, Los Angeles. And it specifically looked at your reaction time, your driving reaction time, DRT. They took candidates having cervical spine surgery, so surgery to the neck, and lumbar spine surgery, with the neck surgery in the neck area of the spine that houses the spinal cord. So it looked at patients who also had myelopathy, so dysfunction of their spinal cord, perhaps weakness in the arms and legs, difficulty walking, and also and looked at the reaction times of these groups before and after surgery. And it also took into account some of the medication you might be on, specifically opioids. So the study included 14 patients who underwent surgery to the cervical spine, the neck area of the spine, and 23 patients who underwent surgery to the lumbar spine, the lower back area of the spine, and compared these patients to a control group, so healthy adults who are not undergoing any spine surgery. So the participants are taught how to use a special computer simulator, where they've got their foot on an accelerator pedal, a gas pedal, doing between 35 and 65 miles an hour. And then they tested their reaction time, where they're given a very specific stimulus, such as brake, turn left, turn right, brake and turn left, brake and turn right. So they did this test before the surgery and then at different time frames after the surgery. Overall, in all of the different groups for cervical surgery, there was not a statistically significant change, and the reaction time was in the region of 1 second, plus or minus, say, 0.1, 0.2 seconds, but not a slight increase, but not statistically significant. Focusing on the cervical spine again, the neck part of the spine, we're looking at patients with myelopathy, so actual dysfunction of the spinal cord with possibly arm or leg weakness, versus those that didn't have dysfunction of the spinal cord, so perhaps only had nerve pain. Overall, if you are myelopathic, your reaction time is slightly slower, but in terms of before and after surgery, it didn't really make a difference. Now let's quickly look at lumbar surgery. And this is quite interesting. If you underwent a single level operation, specifically a decompression, the response times were similar to the patients in the control group, those that don't have any symptoms, whereas all the other groups were slightly slower, just slightly slower. This is before surgery. After surgery, those patients undergoing a single level decompression did have a significant improvement in their reaction time. This is all within the sort of 1 second mark, but statistically a significant difference. And their reaction time post-operatively, even as early as 2 weeks, is comparable to patients who do not have any symptoms. So from all of this, I generally advise in the first 2 weeks, let someone else drive on your behalf. Try and keep the journeys short. Thereafter, if you're not on any opioids and you've only had a single level lumbar operation, I think as early as 2 weeks, it's safe to get in the car. And thereafter, with any other sort of operation, It varies. I think still at 2 weeks it's relatively safe, but you yourself have to feel confident to do an emergency stop without being in too much pain or being too apprehensive. So that's something you can trial a little bit first, either in a quiet car park or with another driver with you. And try to avoid really long journeys, especially in the first week or so of driving. You're just going to be in a lot of pain if you're sat down in a car for that period of time, and then you just gradually over time increase the distance depending on your own tolerance. Hope you found that useful. If you haven't already, please click like and subscribe to the channel. And for more information, please head over to spinemdt.com, where you can see how we can help you.